Greetings. I'm Dr. Catherine Y. Brown, and I am so excited to introduce you to Allison Dsouza. Allison, welcome to our interview on RBWPH Awareness Group TV.
Thank you so much for having me. I'm super excited to be here.
Thank you. So first, I just want you to share where you're located at and a little bit about your background.
Yeah, so I'm currently located in Pittsburgh, Pennsylvania, and I say that just because I'm a Californian at heart, born and raised, ended up moving to Pittsburgh for my work. I spent a year as a lung transplant and advanced lung disease nurse, and now I'm currently a pediatric cardiac ICU nurse.
Oh, I love it. I love it. And you know, my mother was a nurse, as I shared, so I have a heart. Where's my heart? I got a heart for nurses. So tell me about your journey with pulmonary hypertension.
Yeah, so this goes back to 2015 when I was a senior in high school, and I was slowly getting, I wouldn't say short of breath or heart racing or anything like that, just because I didn't know what it was. My body was just kind of telling me to stop and take a break. I was slowly losing the ability to ride my horse, let alone walk to even get my horse. Just something in my body made me stop. So one day, my biology teacher said something about heart murmurs and how people with severe heart murmurs would have difficulty walking to their cars. And at that point, I couldn't walk to my car. So I saw my pediatrician, who originally said that she didn't think anything was wrong, but that she would run some tests. And if they were to come back abnormal, we'd talk about it. But if they were normal, we just work on sleeping more and exercising more. Well, fortunately, things came back very abnormal. And a week later, I found myself in a cardiologist's office. And he was telling me that I had pulmonary hypertension and that I needed to go to UCSF immediately. As a senior in high school, the only thing going through my brain was I had an English presentation that I absolutely needed to go to. And he said, considering you walked in here, I think you'll be able to walk out. But after that, you need to go to UCSF immediately. Gave the worst English presentation of my life and then proceeded to drive to UCSF with my dad, where I would spend the next 9 days. I held the record for the highest pulmonary pressures that UCSF had seen, which is a fairly experienced center. I was in severe right heart failure, and they thought I would need a lung transplant immediately. But instead, they decided to give me a chance and started me on triple therapy, which I remained on for 7 years. And really, they gave me my life back, which was really, really special.
How old were you when you were a senior in high school and you were first diagnosed?
I was 17.
You were 17 years old. And so what was that like with the treatment options? They gave you your life back, but for those who are watching and don't understand what that treatment looks like or what it means, could you elaborate?
Yeah, absolutely. So I started on 2 oral medications along with a continuous infusion. So I did sub-Q Remodulin, which is a little needle that went under my skin and delivered medications at a very, very slow rate. And I was on that 24/7. I would take little breaks for maybe half an hour a day, but at all times, despite that.
Mm-hmm.
And with that medication, I would really say it definitely saved my life, but it's really a pain. It's a pain in the butt, literally. It causes severe swelling, pain, and it was a great way of gaining my breathing, but it had its takeaways.
Mm-hmm. Did you also have oxygen therapy as part of your regimen?
At that point in time, I was very lucky and didn't need oxygen. Throughout my journey, there has been a couple of short periods of time, I would say months at a time, where I needed it, but not continuous use since then.
Have you had any what they call like pH crises where you had to be hospitalized for long periods of time or anything of that nature?
I've been so, so lucky with how my disease has responded to these medications. I've had maybe one stay, but that was related to my Remodulin not infusing correctly
Mhm.
for a day. So I've been very, very lucky throughout this journey.
I love it. Now, Allison, take me back to high school because you had the English, right, presentation.
Yeah.
What did the end of senior year look like? Did we do prom? Just take me through the process because you said they gave you your life back. So what did that look like?
Yeah. So I mean, I went from not being able to walk to my car to being able to show my horse again. I begrudgingly went to prom. I was never like a dance person, but my team was like, you have to go to prom or we're making you go into hospital prom. So I was like, okay, I'll go to my high school prom, I promise. But the big thing actually was I was a senior in high school. I had received college application acceptances while in the hospital. And that was the only thing that was my huge motivation through life. I was going to college no matter what anyone said. And I wasn't going to go to the college that was 15 minutes away from my house. I wanted to go to Cal Poly San Luis Obispo, which was a good 4-hour drive. And unfortunately, my dad was very, very against that just because I just got this major diagnosis. I was pretty close to death's door. After my cardiac catheterization, I recently learned that I had a near cardiac arrest. And I was just very, very sick at that point in time because I hadn't been diagnosed. It was probably way too prolonged, my diagnosis. So with that, I just needed something to prove. Begrudgingly, he let me go to Cal Poly San Luis Obispo with the support of my team. And no, it's just, I felt like I always had something to prove. I wasn't going to let this PH stop me from going to school or doing all the things I wanted to do. I ended up playing in the college polo team.
Oh my gosh.
I just went all out. Like, now that I can breathe, I need to do all of these things.
Oh, I love it. Okay, so I'm going to jump back and then I'm going to come forward. Okay, so tell me this. Were there any signs or symptoms that you had prior to age of 17 in high school getting diagnosed? Anything in like from ages 14 to 16 that maybe you now look back and say, hey, the advice you would give somebody who maybe is your age and is experiencing that? And if so, what did that look like?
I would say the one thing, I didn't realize that this was shortness of breath or racing heart. It was more of like, I wasn't able to keep up with my peers. So in middle school and high school, you should be able to run a mile. I was never able to do that, which fair. There's some kids who can't. And I just thought I was fat and lazy, and I wasn't really fat. It's probably the same way I am now, but lazy. I mean, I feel like that's just a part of my personality. I don't know if it's the pulmonary hypertension, but I would say like, you should be able to walk to your car. You should be able to do things that other people are able to do. And even if you are a little overweight, it shouldn't like, you should be able to do things that a normal person can do despite anything.
That's right. So, all right, now, so we get to college and living in dorms. Take me through college, like when you decided what your major was, your life. I want to hear all about it, Allison.
Yeah, so my college journey was a little wacky. So I spent my first 2 years at Cal Poly San Luis Obispo. Again, I was very adamant that I was going to take care of myself. I was doing all of my medication reorders, dealing with my pump by myself, making my doctor's appointments. I was like, I can do this. So throughout that, I was a biology major because I knew I wanted to be pre-health in some way. So after the first year, I realized I absolutely hated biology, love humans, hate plants kind of deal. So instead, after a year, my pulmonary hypertension nurse practitioner offered to let me shadow her with the PH group. So with that really like motivated and really confirmed that nursing is actually where I wanted to be. So after a year at Cal Poly San Luis Obispo, I applied to nursing schools across the country, and I ended up getting into UCLA School of Nursing, where I would spend the next 3 years, which was absolutely amazing experience, except in orientation, they told me that they didn't think I could be a nurse because I was on continuous oxygen. And it was a wonderful email that I received. And my nurse practitioner really fought for me and was like, no, she can do this. Like, despite this, she's got this. And really, I graduated at the top of my class in 2020. So like, really, oxygen shouldn't stop us. This disease shouldn't stop us. It just really takes, I mean, I had some accommodations like not making me work night shift or not making me commute 40 miles to get to clinical, which would take me an hour or two. Like, there were things like that, but really they didn't believe that my like mental capacity or my physical capacity was enough to take care of these patients.
Wow. So you did have a transition where you were on continuous oxygen though in college. What tell me about that? All right.
Yeah, so my body really hates upper respiratory infections. I don't know what does it, but my body needs a little bit more time to recover. So little spurts around there, I'd have worsening of disease and I'd have lower oxygen saturation. So they thought that a little bit of continuous oxygen would help me. And it did definitely during that time. But once my body recovered, I was back to my normal.
Oh, I love it. You are just, you know what, a hero because and I want people that are listening to hear your heart on this. You had a diagnosis that, I mean, would be devastating for any 17-year-old. Then you said, I am not going to let this hold me back. You started college, you wound up being on continuous oxygen therapy, then to be told by the nursing school that because of that, that you probably shouldn't pursue the profession, but you still pursued the profession and graduated near the top of your class. I'm just saying, like, if anybody misses that story of inspiration, they're not listening close enough because you are a hero. So now, okay, so you graduated from college with the bachelor's degree, right? Now tell me about that transition and then to career because it's exciting.
Yeah. I mean, unfortunately, it was not an exciting time just because it was 2020 and the beginning of the COVID pandemic.
Yes.
So all job opportunities went to zero, at least what I wanted to do. I either wanted to do pediatrics or adult, either ICU or like lung transplant or pulmonary hypertension. I wanted to be involved in the PH community somehow. Those jobs didn't exist in California unless I wanted to take care of COVID patients or wait a year, which unfortunately I will take care of a COVID patient every once in a while, but doing it all the time is just really not in the best space for me. So I applied to jobs across the country to all the major pulmonary hypertension centers and found myself at UPMC Presbyterian for a job on a lung transplant and advanced lung disease floor. I moved across the country, not knowing where Pittsburgh was on the map, not knowing a single person in Pittsburgh, and really just like took this head on. I knew like I needed to be a nurse now. I couldn't live at my parents just riding horses every day. Like I needed to do something. So I made that jump and it was an amazing experience. I really got to see what a lung transplant meant for our patients. Unfortunately, I didn't see them living their best lives outside of the hospital, but I saw how grateful they were for their second chances at life. And really, all of my patients with pulmonary hypertension and I had a really, really close bond. And it was incredibly special to get to be there for them, both pre and post transplant. And then after a year of that job was incredibly physically demanding. We'd have bariatric patients who weighed over 600 pounds that it was help lifting. We were taking, I mean, it was just a lot of patients, a lot of physical activity, which I was happy to do and I still could have done, but I knew that I had a dream that I really wanted to follow, and that was to be a pediatric cardiac ICU nurse. So fortunately, I was offered a job still in Pittsburgh for children's, and I've been there for about the past 8 months, and I really love the little kiddos. The PH babies really, really scare me because they can get very, very sick very quickly. But again, it's just really special to be a part of this community.
Amazing. So when you have the younger, right, children and they're diagnosed with PH, what is it like for them when you tell them like, you know, your story and that you have PH? What is that like?
It is so special. I haven't had this experience at this current hospital, but at the hospital I was diagnosed with when I was shadowing my NP, and I'd pull out my pump and they'd see that, they'd just like brighten up and just realize that like they're not alone in this. It's really easy to feel alone because a huge minority of people have pulmonary hypertension, and even a smaller group of that have to be on infused therapy. So just seeing that there was someone older than them that was really pursuing their dreams and being able to do things made them really, really excited. And especially, I feel like it was really impactful for their parents as well, because they're receiving this diagnosis and they're likely understanding it way more than this child is. So really being there for them to ask questions and just getting to be there for them throughout their journey as well was incredibly special.
I love it. So we have a mantra with RBWPH Awareness Group, which is awareness, empowerment, and hope. Together, we can make a difference. So when you hear the words awareness, empowerment, and hope, and you reflect upon your journey, what are words of wisdom that you would give to myself as I continue this work, but also for those patients and caregivers and medical professionals in the community? What are your words of wisdom for awareness, empowerment, and hope?
I mean, I feel like so many people, I mean, this community is so, so small, and really people care about or tend to care about the large majority, like what is going to help the most amount of people. But that leaves us in the small pulmonary hypertension community behind. Like, we deserve equal research and development. We deserve equal awareness. It's just so, so unfortunate that this disease is just kind of left in the wayside. So really those groups that are supporting us through this journey and really being there for us and raising more awareness so that people don't have to go through the years of being misdiagnosed and the years of getting the incorrect treatment because they're not at a physician who knows how to treat this disease, or at least pretends like they know how to treat this disease. It's so incredibly special to have awareness groups just bringing awareness and bringing more hope to these people. I know so many people have said that they didn't know one other person with pulmonary hypertension, and really they're living their lives just like trying to figure it out on their own. Well, for me, my pulmonary hypertension community has brought the most amount of support throughout this crazy journey. Like, this is a life-threatening disease. You need people to understand what your shoes are. Like, I look completely healthy. If you saw me at work, nobody could tell the difference, but really we're special. We deserve to be heard, and we're here.
Oh, I love it. I love it. So where can we expect to see Allison in the next 10 years? What's on your list? Because you've done so much already.
Oh, I would love, I know in the next couple of years, I'm really just trying to be the best nurse I can possibly be. The cardiac ICU, especially with these kiddos, is a very, very scary place. And I'm learning so much every single day. So really, I want to be able to be at that place where I can take care of any patient without being scared for my life or the patient's life.
Mm-hmm.
And then the next thing, I would love to be a nurse practitioner for pulmonary hypertension patients. So really, once I feel confident in my own shoes and ready to go back to school, I want to give back to this community as much as it's given to me. So hopefully that's on my horizon. But again, I don't know where life is going to lead me, and we'll see.
I love it. Is there anything else that you want to share that I have not asked you? And I've asked you a lot, but anything else that you want to just share, maybe from the heart, for people that are watching this?
Yeah, well, I really appreciate, if pulmonary hypertension hasn't really hit close to home and you're here and being a part of this group and raising awareness, that is so incredibly special. And I thank you for that. And then for those patients who are near and dear to my heart, I would just say, always have hope. It's a crazy journey. There's going to be a roller coasters of ups and downs, but we're all here for you, and really, live life to the fullest, and you can pursue your dreams.
Oh, thank you, Allison. You're bringing tears to my eyes because you're so special, and your heart for what you are doing, it radiates. And it does. It reminds me of my mother, because even though she was sick and she got this terminal diagnosis, in her case, the nurse in her always cared about people, and she wanted to keep giving back and keep raising awareness. And that's the same passion that I hear in you as a nurse that says, I'm diagnosed, right, with PH, but it won't define me. I will continue to answer the call, right? And to serve people. And I think that's just the beauty of nurses, and just the beauty of people with a beautiful heart. You're right. My mother says, my heart works differently, but my heart works differently, right? And so I think that's why you all are my heroes, because you continue to serve. So thank you so much, Allison. On behalf of my family, the nonprofit, and my mother, who I know is smiling down. I know you're going to be an amazing nurse practitioner, and you are going to continue to serve this PH community in excellence and bring awareness, because it's time for those voices to be heard. And so just thank you for being here with me today. I truly appreciate you.
Well, thank you for having me and for doing all the work that you're doing. It takes an incredibly special person to pursue things like this and really bring awareness to our little group, but little group of strong heart warriors.
I love it. I love it. Well, thank you all for tuning in today. Now, I know you have met Allison and you are completely impressed like I am. So like, share, follow this message, and we are going to have to check back in with Allison, right? At least in the next few years, to hear about her journey. But thank you all so much for tuning in, and thank you again, Allison. You are amazing. I'm telling you, Allison, I want to hear like your journey and when you start school and everything, because I know you're just going to do big things. You're already doing big things, but you're going to do bigger things.
Thank you so much.
Oh my goodness.